is one of my favorite diagrams that I've seen related to nutrient absorption all along the intestinal tract. So as we can see that each region of the intestinal tract will have various priorities of nutrients that are absorbed. So I'm going to point out a few things that I think about. So any disorder or disease that would affect various regions, such as gastritis or ulcer disease or gastroparesis, anything that's going to affect digestion and absorption in the stomach will have issues with digestion of those nutrients that are associated with it. So when I say that, I mean they will have risk of these nutrient deficiencies. It doesn't mean it's actually happening, but there is a risk because of the need for proper mucus and proper intestinal lining to create an environment of optimal absorption. If a disease disrupts the absorptive surfaces, then we do consider there to be an increased risk of nutrient deficiencies in these regions. So when you get into the duodenum, which is the upper part of the small intestine, you can see that many minerals are absorbed there. So a lot of people who have dysbiosis of the upper intestine in situations like small intestinal bacterial overgrowth, or in conditions of the small intestines like Crohn's disease, you really have to be looking out for these nutrient deficiencies. Now the body will do its best to absorb these nutrients, and we might actually see appropriate levels in the blood, but that does not necessarily mean that the levels are enough to create intracellular sufficiency. So I'm getting into looking into lab tests that have both extracellular measurements of nutrients and intracellular levels of nutrients, especially in people who have high risk of nutrient deficiencies. You can also see some of the fat-soluble nutrients are absorbed in the duodenum, and then as we travel down to the jejunum, we can see more protein absorption, simple carbohydrate absorption, fat-soluble vitamins, and amino acids. Further down the jejunum, more of your B vitamins are disrupted. So a lot of people who have SIBO will have the dysbiosis in this distal jejunum, and we might see nutrient deficiencies popping up in these areas. Again, Crohn's disease is one of the most risks for nutrient deficiencies, and so there may be a need for intracellular and extracellular measurement of nutrients. The large intestine, which we see a lot of disorders such as microscopic colitis, ulcerative colitis, even Crohn's disease can affect the large intestine. There can be issues with water reabsorption, bile salt reabsorption, electrolytes such as sodium, chloride, and potassium, and our B12 levels also would be nearby in the distal ileum. I also want to point out that in the large intestine, the short-chain fatty acids are absorbed, and this is really significant because a lot of issues with SIBO and dysbiosis is that the body's actually making short-chain fatty acids higher up in this on the small intestine because there's sort of fermentation of carbohydrates taking place way high up. And so as you can see, these short-chain fatty acids should be absorbed in the colon, and we really want propionic acid, butyrate, acetate, these other short-chain fatty acids to be produced down here. So it begs the question, when you're taking butyrate supplements, that you would really want them to be time released and stabilized so they can get further down before they start looking for a place to be absorbed. The other way to take butyrate is through suppository or enema, but this is where they're needed most, in this large intestine. And also we want the prebiotics to get down to this area, so it begs the question of what's the best way to take prebiotics, whether in a capsule form, time release form, powder form. These are all things that we need to be thinking about. And that is just a quick overview. I thought this was a very nice diagram, and I hope this is helpful in understanding where the nutrients are absorbed.